Hi there. Hola, hola. My name is Max Cisneros, and I am the Latinx Program Officer for the New Haven Pride Center in New Haven, Connecticut. And so, first off, I want to say happy Pride to everyone. It is September. It is Pride Month here in Connecticut, in New Haven, in our world, and so that's Pride Month for you too. And so, we're not letting the situation get in the way of us being able to celebrate our pride, and that's what we're choosing to do here today and for this month. And I want to thank you for joining me. We're having a conversation with panelists that I'm bringing in. And this conversation is pretty much something that I've been thinking about for a few months now. And I'm really happy that it's coming in fruition. And folks at the center have been so awesome and supportive about us having this conversation. So, welcome to Queer and Pandemics. And let me start by bringing in our first panelist. His name is Marco Castro Boroquez. Y I want to thank him for being here porque él lo mencionó earlier that it's in a virtual panel, it's kind of tough to be able to land recognition, kind of like the ignition of the land we're in. However, for this one, it's a little easier because I want to recognize that I saw Marco speak at a plenary for La Familia's Encuentro last year. And the conversation he had for me was so impactful that it planted a seed that eventually turned into this right here. So it's significant to have you here with us today to have this conversation. So I want to thank you. Marcos is an HIV organizer and an impact filmmaker. He advocates for the human rights of LGBTQ people and people living with HIV. As the convener for Gente y Dignidad, a grassroots coalition of queer advocates organizing virtual conversations in Spanish. He is addressing the lack of language justice, access, and inclusion of the immigrant Latinx communities. For he is the co-chair for HIV Racial Justice Now. He was the lead organizer for the Coalition of Californians for HIV Criminalization Reform, resulting in the passing of SB 239, transforming the legal landscape in regards to HIV criminalization in California in 2017. In Mexico, he was the co founder of Corazon Abierto, LGBTQ Culiacan, AC. He was selected by Obama's White House for the prestigious Champions of Change Award for his film El Canto del Colibrí, or The Hummingbird Song. Marco is temporarily residing in Nevada, where he co founded the Nevada HIV Modernization Coalition, a group responsible for SB 284 that was signed into law by Governor Sisolak in May 2020 to create the Advisor Task Force on HIV Exposure Modernization. Earlier this year, he was appointed by the city of Reno for the Human Rights Commission and the Arts and Culture Commission. And more recently, he became a member of the Community Working Group for the COVID-19 Preservation Network, or COVPN, which conducts studies of vaccines and monoclonal, ayúdame por favor,
Monoclonal?
monoclonal, thank you, antibodies to prevent the spread of coronavirus. He recently adopted by a kitten named Atlos Gatos, the inspiration for an upcoming bilingual blog about cats and HIV. Thank you so much for being here with us, Marcos. Te agradezco mucho tu presencia y tu energía.
That was painful. That was a long bio. It's great to be here with you, Max. Thank you so much for having me. I'm humble.
You humble us. And now I'd like to bring in Dr. Gary Blick. Dr. Blick, there he is. Big smile. Dr. Blick is, let me see, I got it right here, is the Chief Medical Officer and founder of Healthcare Advocates International, co-founder of HIV Advocates, and founder of ZAP, Zimbabwe AIDS Project. Dr. Blick is an internationally renowned HIV/AIDS clinician and clinical researcher, lecturer, and humanitarian. His career in healthcare spans a length of more than 30 years and was inspired by national health events occurring at the time of the 80s, and he has studied at the University of Miami Medical School. He also completed his residency at Yale University School, affiliated with the School of Medicine. I want to thank you so much, Dr. Blick, for being with us. I think repeatedly I told you in preparation of this conversation that I can't imagine having a conversation, like this without having your voice involved here. So thank you so much for being part of this.
Thank you, Max. Thanks for inviting me. It's a pleasure to be here with you.
So first of all, I want to observe where we are right now. I think that in this moment there are a lot of folks who um, who are feeling a bit of whiplash, feeling a bit of like we've been through a trauma, and in terms of the pandemic here, and in many cases, I would imagine that there are folks who are feeling re-traumatized due to the effects of what happened, in the 80s and 90s. And so I'm going to speak to the specific subjects I'd like to talk about here. So we kind of like center our ideas and thoughts around those. But before that, I wanted to share some numbers. Um, in Connecticut, there are five major cities that are most affected by HIV. That is Hartford, New Haven with 1,395 cases, Bridgeport, Waterbury, and Stamford. And I also happened to look at the data, and those also happen to be the five cities that are most affected by COVID as well. So I think that there's an interesting correlation here that I think that we're going to be examining more and more as we go into this conversation. And also, I want to also remind folks that to this day, there are still 2 million people who are dying every year because of lack of medicine, lack of treatment. That number also extends to 5,500 every day, which also includes four every minute. In the United States today, 40,000 folks are infected every year. So the house is still burning. Folks may feel like we've gone, much further ahead, and we have, but there's still many things that need to happen. And so, with that, in that spirit, I want to bring in the topics, and then we'll go right to the questions. And so, the topics are: what are the lessons that COVID-19 health justice advocates today can learn from the efforts of advocates in the darkest days of the AIDS crisis during the 1980s and 90s? That's one. The second is the work or unfinished business that was started by those early activists seems to be dormant or non existent in some places. In this current crisis, are there now ways health justice advocates today can revisit these values that have been, for the most part, ignored by both systems and HIV/AIDS activists today? That's number two. And number three is a bit of a personal note here, trigger warning. I am a queer Latinx cisgender male that openly identifies as HIV positive. In these identities, as I step into these identities, I feel a sense of solidarity with folks who are COVID-19 positive. In the coming years, I would like to know, how can we create more spaces where these groups can support each other, can heal each other, can teach each other, and to build community that can possibly save lives into the future. We have done it before, and I know we can do it again. So that is the tone that I'd like to start this conversation with. So my first question to you would be, what, in your view, I'm going to ask you Marcos primero and then Gary. In your view, what do you think are the strongest lessons that the 1980s and 90s and the activists, when we're talking about ACT UP or the Denver Principles, what do you, in your view, are the strongest lessons that we may be forgetting or just need to know in terms of the pandemic today?
Thank you, Max. Can you all hear me okay?
Yes.
Yeah. I wanted to first um, acknowledge that I am speaking to you from from Reno, Nevada, which this was previous territory um, of the uh, Waho people. I'm like I blank in the moment that and that I'm basically occupying their territory. And I wanted to acknowledge their humanity and their tragic story, their tragic history. I also want to acknowledge the fact that I am no better than anybody else that is hearing or listening to us right now. Anybody who is actually who's actually watching or listening. I want you to know, just to center myself here, is that I'm just equal to all of you, and that you can teach me as much as I can learn from, as much as you can learn from me as well. And then lastly, I wanted to appreciate Dr. Gary Blink for his work in HIV, for being such a champion. I think that as a queer Latinx immigrant man living with HIV, so Max, you're not alone. I wanted to appreciate so much the work that you do for the community, and that you keep doing that, especially internationally, which is really important. And it's an honor to be speaking in the same panel with you. Thank you so much.
Thank you, Max.
Now,
Appreciate it. Thank you.
thanks. I want to answer this question, but I wanted to, Max, it's a difficult question to answer, I think, because we haven't seen not even the beginning of the end of COVID-19. And we already started talking as if that has passed. Look, it's been 40 years almost since we learned about HIV, and we still have not seen the end of HIV. Despite the many efforts to end the epidemic, I can just point out one little thing, or one single thing, for us to like recenter ourselves. The ending the epidemic plans in the US have not explicitly acknowledged undocumented people living in this country. And so how are we going to end the epidemic if we leave people behind? In the HIV field where I work, we often say that we are not leaving anybody behind, but in reality we do. So I wanted to just center us in that premise, because I think that is very important to counter the narrative that media creates around realities that are actually created by them, right? The reality, as you were mentioning, is that HIV, I visited UNH a couple of years ago, and one of the things that I was very surprised is that people thought that people in the US don't have any issues with HIV, and that we are okay. And which in reality, like in the south of the US, it equals to the conditions of countries in Africa. And so it's really important that we acknowledge that, because funding for HIV, as it became browner or blacker, funding went down. COVID-19 is a perfect example too, that the president himself like basically lost interest when we learned that the communities that were being decimated by this virus were mostly communities of color. And so the lessons that the HIV movement, in my opinion, has taught us is the importance to center the patient as someone who is not always the patient. Like in the Denver Principles, it's important that we actually listen to the people living with HIV. We are the ones that know better what is good for us. And we have worked really tirelessly for the entities, the health entities in the world, to understand that the fact that I live with HIV doesn't make me anything less than anybody else. And thank the universe for you equals you, and the antiretrovirals treatments that actually now is not only helping HIV positive people, but it's also helping HIV negative people to stay negative. So they should be very appreciative of us rather than to discriminate against us, which is often happens. Lastly, a lesson that I think is important to observe is around the criminalization of people living with COVID-19. I entered the HIV field through doing work on HIV criminalization, which is amazing that actually exists in this country. Is in 30 plus states you can be criminalized because you're HIV positive and put in jail. There is a person right now in Texas that is going to be there in jail for 30 years because he's spot on a police person. And so I think that we have seen activities in different countries all over the world where people are being criminalized. And of course, people are, I'm finishing, right? People are also stigmatized COVID-19 to the max among family members, inclusive. So I think that it's important to see those areas of the work that we do on HIV, and to see how negative has been for HIV, and not to do that for COVID-19.
Thank you, Mark. Gary?
So Marco raises all these great points. I mean, Max, you bring up the darkest days of AIDS and the darkest days of COVID. Well, darkest days of COVID are now, just like the darkest days of HIV/AIDS. And in the early days when all we had was say AZT. Well, right now, really all we have is remdesivir. And remdesivir is a modest effect, like AZT had a modest effect. And indeed, AZT alone turned out not to be the therapy of choice. As remdesivir alone wouldn't be the therapy of choice. We had steroids to help people live a little bit longer. But we are really in the darkest days right now. With what 1,300 people died yesterday. We're still seeing 40,000 infections a day, and we're at this plateau that's terrible. Because we're about to rise with winter coming in and people going back indoors again. There's the writing is on the wall with all this. But the lessons we've learned from it, Max, is like, remember what happened. Marco, you mentioned stigmatization, discrimination. Boy, was it so thick back in the 80s, as it is still now with HIV and AIDS. Almost 40 years later, we're still dealing with heavy HIV stigma and discrimination. So what did we do in the early days in the 80s? We got together as a group because we were stigmatized by the names that were placed on what was later become known as HIV.
Right.
Do you remember, Max, we talked about this. Remember gay-related immunodeficiency syndrome? We were labeled that this was a gay disease, GRID, right? And then I remember it didn't take very long to expand that definition, and we then labeled everybody else. It became the 4-H club, right? Sort of like, the Lions Club, right? The 4-H club. Homosexuals, hemophiliacs, heroin or intravenous drug users, and Haitians. So we labeled and we stigmatized Haitians and we stigmatized gays and, homosexuals and so on and so forth. I mean, it was okay, to have hemophiliacs because they were sort of mainstream disaster that the blood supply was infected and they were getting it from the products. But just what happened in the early days of HIV is happening right now. Silence. Remember, we think silence equals death. And indeed, from 1980 through 1987, 7 of the 8 years of the Reagan epidemic, we didn't even talk about HIV. It was stigmatized, right? Well, are we talking about this now, Mr. President, or have we silenced it? I mean, it was January 28th, 29th when you were told that this was going to be an epidemic, much like the 1980 pandemic, not like H1N1. But we're silenced. We're not even talking about this now. We have a good portion of this U.S. population that thinks it's no big deal. It's gone away, okay? I've got one of my patients that I spoke with today who was up in rural Vermont with a cabin up there, and his neighbor happens to be one of the politicians in that town up there, and she came running up to him to hug him, and he went, "Oh, wait a second. And she said, once again, I don't know if this is, we can consider this like cable, but she said, "What, do you really believe that shit?" Okay. And she, as a politician, said that to him. Like, this is like a hoax. The next door neighbor on the other side basically said the same thing to him. Say, what do you really believe that? Most of these deaths are not from COVID. These are deaths from heart attacks and stroke, comorbidities, right? Well, no. Just like in HIV, people with HIV and aging now are dying from the comorbidities of being HIV positive. That's the diabetes, hypertension, the obesity, smoking. Just like COVID patients are dying from COVID, and many of them have these comorbidities, just like we have in HIV and aging. There's so many similarities here, going back to the early days of HIV. And the lessons we learned that, silence equals death. So if we don't speak up ourselves, if we don't create that activism like we did with ACT UP New York and ACT UP Paris and ACT UP the globe, essentially, that really changed the FDA and went right to Tony Fauci and convinced Tony Fauci, who's still there 40 years later, there to speak on behalf of COVID and everything. These are the people we need to be with. And don't forget, it's all about science and facts. It's not about what's spewed out there politically and what's put out there for whatever reasons politicians have to spew, disinformation and misinformation. We ourselves have to get together and get the facts out there. We could have activism right now, Marco, right? We know that 50% of people with COVID are from the underserved, underrepresented communities, the Latinx communities, the Black and Hispanic, Black and African American communities. We could be rallying around together right now. We can go right to Anthony Fauci, just like we did with ACT UP New York, and sit down and come up with a plan about how to get this out there. The only difference now versus then is all of this. We didn't have this Facebook Live and Twitter and all of our social media to get the word out at that point. But we do now. We have the power of social media to spread the word and to spread the proper information and can do our own advocacy. So the lessons are the same. We learned them back then. We just have to apply them to 2020 and make sure we get the word out and start standing up for our communities that are still stigmatized and discriminated against today.
There's a lot there, and I feel you hit. We're going to be going back to a lot of these points, here and there. But the piece that I feel like I'd like to get a little bit more on is the basically beating up on the president. No, I'm just kidding. It's basically just being able to ask ourselves, how have societies decided to deal with the current situation, right? So when I think about the lessons, I think to myself about, okay, look at, and I'm not only mentioning this because today happens to be Mexican Independence Day, Viva Mexico. Also, because if you look at the ways that Mexico, for example, the way Mexico decided to handle this was the president, Andrés López Obrador, decided, all right, this is what we're going to do. We're going to temporarily nationalize all the private hospitals. All the private hospitals are going to be nationalized, and anybody that has anything to do with an ailment or a sickness or an injury that's not COVID related goes to the private hospital, and therefore, all that medical for all was covered. By the way, all of a sudden Mexico decided Medicare, everybody gets free Medicare, so that's what they decided to do. Nationalize the private hospitals, and all folks who have non-COVID situations going on go to those private hospitals, while at the public hospitals, all COVID. So that's how they ended up, in my view, lifting the burden on the individual, lifting the burden on the public. The government came in, stepped in, and said, we have the resources, we have the ability, we're going to make it easier on you. We urge you strongly to use masks. We urge you strongly to keep your distance, but we're going to do what we can do to make it easier on you, because you still have to go to work, you still have to survive, you still have to make your paper. And we just think that we want to make it easier on you, So that's the way the Mexican government and society decided to do this. Here, it was different. And I think a lot of people were hurt due to that. And so my question leads to why is it feels as though that the burden is on the individual here in this country? And on top of that, why does it feel like, instead of, because back then in the 80s and 90s, there was one clear target. It's the politicians, it's the pharmaceutical companies, it's the folks who don't care about us dying, right? And now it feels like the enemy isn't the institutions, if I could use the term enemy. The target is the individuals. We're picking at each other, you know. And so my question is, short story long. My question is, what is it about our society here that causes us to feel like we got to pick on each other and not really focus on the institutions that are in charge to really make this process easier for us to survive, or at least just get out of the way? I'm going to ask Gary and then Marcus, please.
Yeah, great question. And there's a great analogy. It's like, the silence of President Ronald Reagan is no different than the silence of President Donald Trump. Okay. So they are equivalent in the 80s to 40 years later. All right. I mean, there's a reason that, Thomas Evans and I created, HIV advocates and asked people to be stigma warriors to spread the word of HIV, to help overcome stigma and discrimination of HIV. Basic information. You just got to get to the basics. Remember, Marco just mentioned U equals U, undetectable equals untransmissible. That's one of the messages that HIV advocates get out of there. But if we had COVID advocates, one of the biggest messages we would say right now is a vaccine is not our answer. You know what our answer is? Masks. Okay? This is not about your liberty. This is about saving lives, okay? We get stigmatized for wearing masks by at least 1/3 of the population in this country. No, 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 no. This is better than a vaccine, okay? This is how you save somebody's life. We have proven with science and facts that when we wear this, you don't infect me, okay? Because you're wearing a mask. And we've also proven I don't infect you, but it also saves our lives. It works both ways now. We've proven that masks work both ways. Okay. So if I have COVID, I don't infect you. And if you have COVID, you infect me less often when I'm wearing a mask. Okay. This is much better than a vaccine. A vaccine, we're going to have to then get out and try to convince the entire population who are anti-vaxxers that this is the way to go. And when we have silence, like we have silence from our president, silence equals death when it comes to COVID-19 also, okay? That's why when you see these events and you see all these people getting together, nobody wearing masks, those are super spreader events, okay? So we knew it back in the early days, we coined safer sex, right? Well, safer COVID, no different than safer sex, okay? You spread this through respiratory particles. This is the way you do it. You don't need it. You need condoms originally in the early days, to stop the spread of HIV. Well, now we have undetectable equals untransmittable with PrEP, okay? This is PrEP, okay? It's no different. It's a simple message. We all can do this, not because it takes away our liberties and because you're being told to, but if we had a president who had a national plan for this, we'd all be wearing masks and we wouldn't have to worry about 4,000 people dead by inauguration day. We could save a couple 100,000 lives now if 95% of people would just wear their masks. It's so simple. And where we've gone wrong is by not talking about it from the top. Our administration giving disinformation. Tony Fauci, Debbie Birx, Robert Redfield, those are our scientists. Those are our public health experts. They can get the word out. But when they're being told, oh, I disagree with them, I think otherwise, that's what spreads the disinformation, right? Big message we learned from that.
Yep.
Yeah. So if we had like stigma warriors for COVID, just like we do for HIV advocates, if we had a COVID-19 advocates, a campaign, we could do the same exact things we did in the 80s, but translate it now to COVID-19. There's no doubt we could have meetings with Tony Fauci if that was what was organized at this point. And there's no reason why we can't have COVID-19 advocates now.
I agree.
Go ahead, please, Marco.
I agree. I agree. And we recently had a meeting, a number of organizers in the HIV field, to actually acknowledging that the HIV field or movement is in the best place to actually advocate for coronavirus. And we have the best resources, infrastructure to continue the work, for example, of the vaccine. We don't have to reinvent the wheel on that because we can use the infrastructure that is there for HIV. Sadly, the barriers, to answer the question, to the last question that you posed to us, Max, the reason because why we are against each other is because of racism. Yeah, plain and simple. Is racism the very cause of most of the issues that I struggle with? Most of the intersectional oppressions that I have to deal with on a daily basis, it goes down to racism, plain and simple. And I think that it's very important that everybody realizes that racism affects all of us. Yes. And the reason because Black and brown people are dying like insane of COVID-19, it is because of racism. Because of racism, they had to eat McDonald's all the time instead of eating from the farmers market. They had to basically work 3 jobs because there is no an immigration system that acknowledges their humanity. And so just a couple examples. Those are the reasons why they die, because they are the comorbidities that Dr. Blick was talking about. And then if on top of all of that, you have communities that actually are lagging behind because of the institutions that are in place, that actually, benefit out of their out of the suffering of these communities, then you have a president that actually utilizes the term the Chinese virus. Um, the number, I don't like to talk so much about this individual, but because but the number of things that he did, I thought that it was like that I was in another dimension, that was not like, I didn't even understand how to process that, right? um, so unfortunately the leadership of this country, in my opinion, is the direct, which is very racist. The whole administration is racist. And so the leadership, if the leadership, instead of allowing the CDC to do what they were ready to do, um, started to intervene and prescribe things on national television without having no even one day of training on any science, and by promoting not believing in science, um, I think it's a crime against humanity, and I think that many people have died in this country that they should not have, and many people are suffering. But I'm gonna say this last thing: the suffering of people dealing with COVID-19 has been very dramatic. They die alone with nobody next to them. But the suffering that my sisters and my brothers that passed away of HIV back then, there is no comparison on the amount of suffering that so many of, again, my brothers and my sisters endure, is just humongous and is overwhelming, just to think about it. That's why I think for me it's very difficult to compare COVID-19 with HIV.
But Marco, from a doctor's point of view, I was able to go to people's homes when people were dying from HIV and hold their hands and hug them and kiss them and say goodbye. Now I can't even go to a hospital. Now I have to help people die via telehealth, telemedicine. You know what that's like? And when we saw the chaos and the destruction, the cataclysm that hit, Connecticut, New York, and New Jersey, back in March, April, May, you think the lessons would have been learned from that. But no, it starts at the top. If you don't have a national plan and you have saying somebody, I personally, I'm against masks. I don't think I look good in them, or there's, this questionable what the science says. All that spread of disinformation is why we're in the problem where we are. There's no reason we should be having 40,000 infections a day here. There's no reason that Brazil needed to go through what they went through, out there. There's no reason these countries had to repeat exactly what we knew we could prevent, and we're doing the same thing. Marcos, you said it in the South, where stigma discrimination is all there, without a doubt. What happened? The same thing happened down there. Why did Florida go through this? Why did Texas go through this? Why did Arizona go through this? Why is it spreading through the country? It's because they didn't learn the lessons that we learned here, at the beginning. It's like you think it just didn't happen. You think people didn't die from COVID? Of course they are. And we're going to have 200,000 dead within the next week or two. I predicted 200,000 dead by election day. Forget it. It could be closer to 300,000 dead by election day. And most of this unnecessary because we didn't talk about it. You definitely talk about racism. Listen, this country was founded with racism. We know that. But the only way you overcome racism is you make people aware of it. You educate people about what's going on, and we realize that there's got to be racial inequities. You start at the top right now. He denies racism. He denies racial inequities. He denies Black Lives Matter. He denies all the things that he just doesn't want to see as the truth that we know is the truth. And we need to get together, and we need to fight this together. That's the only way it gets to happen. Otherwise, they roll over us, and it's got to change. And so one thing we can all do now is get out and vote on November 3rd, okay? Forget about suppression of the vote. Get your mail-in ballots and get out to your mailboxes, get it in there. No matter what he tries to do, we can fight that and get around that. We just may need to get our ballots in the mailbox 10 days early because, mail may be slowed by all this. But anything they try to do to stop us, we can fight against it, okay? It was done back in the 80s. We're still doing it with HIV here in 2020. And yes, we can do the same thing for COVID right now. We can fight racism. There's a reason Black Lives Matter exists today, okay? And they should exist indefinitely until we overcome racism, which may take us another decade, another 2 decades. It may take 50 years, whatever it takes. we need to keep fighting together and organizing together and make our voices heard, so that at least we don't get plowed down by administrations like this. Okay, so we've got to talk about it. We've got to get the proper information out, science and facts. Okay, that's what it's all about.
Absolutely. And I would just add,
Yeah, and
on top of Marco, sorry, go ahead, please.
no, just I just wanted to make sure that we acknowledge the fact that agree with Dr. Gary, um, the fact that that HIV right now needs to be and COVID-19 also. We need to stop seeing HIV and COVID-19 just as a biomedical issue. We need to also acknowledge that it's an economical issue, it's a cultural issue, etc. And that's the issue that is damaging HIV. That we see it as a biomedical thing. The mess is all what you need. No, I need food. I need housing. I need to have equity and equality in front of the law. And most people that are brown and black don't have that in this country right now.
So true. Absolutely.
Thank you. And that also adds to the intersectionality of being COVID positive, HIV positive, brown, trans, black, queer. Like, we can keep on going. And if you just add more and more layers, I think that piece is something that's a lot of the times lost on folks. I would just add, from what I agree with everything the doctor said, I would just add that not only voting, and I've had my own journey when it comes to voting, as well as masks, I'll admit, but not only voting, but filling out the census is also another powerful way. And this is what this conversation to me is about: empowerment. Not really empowering folks, but providing folks a tool so they can empower themselves. And
It
that's
is empowering folks, Max. Exactly what we're doing.
Yep, and I think that that's part of what I feel like is the tradition of ACT UP, the tradition of the Denver principles, that I think that could be really useful to think about in these times now. Particularly when I'm thinking about that you make a magnificently important point about science and fact. And I remember reading, as well as watching in one of the documentaries, How to Survive a Plague, that at one point the ACT UP had a rift, had a schism within the group between folks who were focused on the science, because they were teaching themselves. These are everyday folks who have jobs and taught themselves science. They taught themselves because the scientists weren't doing it. The pharmaceutical companies weren't coming up with treatments, so they ended up becoming their own scientists. And here's a way that the tools were used to empower the very same community that was suffering. And so they created a group called TAG, Treatment Advisory Group. And I feel like that is a fascinating lesson to think about for the folks happening today, for the pandemic happening today, for the COVID-19 activists that want to become their own, because it doesn't seem like there's a lot of energy on the part of institutions, with a few exceptions, to save lives. So my question goes to, in what ways can we envision a tag sort of scenario happening for COVID-19 activists? Is that something that needs to happen in HIV/AIDS activist spaces? Is that something that needs to be pushed on pharmaceutical companies and public figure officials? How can we envision a way that we can make COVID-19, but provide a way for COVID-19 patients to be their own doctors, to be their own scientists, to know enough that they can suggest to the doctors, I know what I'm suffering from, I know my experience, you know the biology, let's work together. Is there a space to work towards there? I'm going to ask the doctor and then Marcos, please.
I absolutely think so, Max. Because in the early days, what I did was I empowered my patients with facts, with science, with basics, and you don't have to get too complex about this. We empowered people to be able to go into their doctors to say, listen, these are my T cells or my viral loads. I want copies. Okay, don't just tell me my HIV is fine and I'll see you in 6 months. They're my labs. I want copies of my labs so I could look at them, so I could deal with them. you're not going to get thrown out of a clinic. And if you do get thrown out of a clinic for asking for that, you don't belong in that clinic and you get out of there to begin with. Okay. So the bottom line is you are entitled to go in there. So what we empowered people to do is make a list of questions. You can't make 10 questions. You're not going to get that done in 10 minutes, but bring up your top 3 questions and you conduct your office visit. Same thing goes here. We've got to empower people in the Latinx community and the Black and African American communities to know that you're more at risk here, that people are dying as a result of the lack of talking about this, the lack of the information that's out there. And you can not be intimidated by your provider. You go in there and you talk about the things you need to talk about to be able to get what you need out of that visit. And you can now, thank God, we have more, testing for COVID, so you don't have to rely on your doctor saying, oh, it's probably nothing, oh, maybe it's a cold and all that bit. If you're concerned that you've got COVID, you can now go, at least here in Connecticut, we have called the Docs Medical Group. You can go in there and get a rapid, not a deep nasal, but a superficial nasal swab, and in 30 minutes you get your rapid antigen test to know if you're positive or not. It shouldn't be that you have to wait to get tested in this country. It shouldn't be like it was where you had to beg to, or you had to be really sick to go in to get tested. Everybody should have access to the tests. Max, I still, for my office, don't have that rapid saliva test that's going to be available in 5 or 10 minutes. I don't have a way to get it. Everybody talks about it, but it's not available to us. But you can go right out to Docs tonight, right now, if you think you have even a question of an exposure to COVID. Don't listen to what happened in the CDC. That was our government and our president co-opting the CDC and getting those things out of the guidelines, where the CDC says now, oh, we don't recommend testing if you've been exposed to somebody with COVID. Damn straight, you be empowered by it. You go to get your test done. You demand that test done, and you'll get the test done. All right, and we can do it in 30 minutes now. So, and soon we'll have a test where we can do it in 10 or 15 minutes. Don't listen to it. Max, you know me. I don't get onto my Facebook page and talk about Democrats, Republicans, this and that, until all of a sudden the president co-opted the CDC. And earlier than that, he co-opted the FDA. And for instance, convalescent plasma, which, by the way, we were doing in 1989 for HIV. Yes, it may have a role here, in COVID-19, but the president co-opted the FDA and made a press conference the day before a national convention with the head of the FDA, Dr. I can't believe Stephen was actually standing there at that meeting. He should have refused to go and thanked the president for the great job he's been doing and gave an emergency authorization for COVID convalescent plasma, which at best, the evidence is weak, and it probably shouldn't have gotten that kind of thing. But the president politicized the FDA, and I don't think that's going to happen with the vaccine. I pray it doesn't happen, because there are independent data safety monitoring boards that really oversee this, and the companies have sworn that politics will not get this out. That's why we won't have a vaccine, by election day. But we may start getting early evidence out by October. But the bottom line is, as soon as we politicize the FDA and the CDC, our top regulatory and our public health organizations, that was it for me. I had to get onto and start posting and getting really facts out there so people knew what convalescent plasma was about, so people knew what vaccines were going to be about, so people, weren't going to be co-opted by this with misinformation. And I still think it's the same way we got to do it now, Max. People can get together. We can go sit with Tony Fauci. We can, talk about these things. We can get to the organizations and to the politicians and make sure that we get the benefits out there that we need for people that are underserved and underrepresented and discriminated against and stigmatized on a regular daily basis. It is possible. We did it then. We're still doing it for HIV, and we certainly can be doing that now for COVID-19.
Yeah, I think that the HIV community, it is addressing a lot of the issues that Dr. Blink mentioned. When the vaccines trials were excluded people living with HIV, we intervened, and in a week or so they fixed it. When the CDC starts sending data to the White House instead, or the data was diverted, we also intervene. The HIV movement has been in every single step first advocating for people living with HIV when we didn't know how much we were be affected by this coronavirus, and now acknowledging the fact that systemically we actually are again in a different dimension that has no explanations. You know, there is no reason why the things happen the way that they have happened, because we know very clearly that the solutions are different and people go along with these things. You know, like I think that it's been way too long for us to wait until election day to consider new leadership. I think that from the moment in the campaign where the then candidate called Mexicans rapists, that was the last thing that I saw a speech by that person. And um, and so I think that we have continued doing that. And I also wanted to acknowledge and to talk a little bit about the Denver principles that you've mentioned a few times. Maybe some people don't know what that is. And I am part of an organization that is a network of people living with HIV that is called the HIV, the U.S. Um, People Living with HIV Caucus. And in that organization, one of our founding principles are the Denver principles, and as well MIPA, or GIPA, according to wherever you are. And those are basically philosophies. The Denver principles were created by patients that didn't thought that they were patients living with HIV. Back then they called it AIDS. In Denver, in a conference that happened, the this group of men actually got together and addressed the conference at the very end. And they told them that they didn't want it to be seen as patients, only occasionally, and that they wanted to basically make sure that they have something to say in the decision making of everything related to HIV, and that they had the right to actually create groups addressing and supporting other people living with HIV. To me, it's actually an amazing empowerment piece that I use on a daily basis to empower myself. I am a boss of dissident in the HIV movement, yet um, I feel very empowered by that. And GIPA is basically, or MIPA, is meaningful involvement of people living with HIV, which is basically another of those principles that we use, where like you cannot just put HIV positive people as icons of whatever work you do and use them. You have to actually create spaces where people meaningfully are involved in the HIV epidemic. The same thing, the same principles can actually be utilized by creating groups around COVID-19. And I will just add one piece. I am the co-chair of an organization that is called the HIV Racial Justice Now, which is another coalition by amazing people that work in the HIV field that are Black or brown. We wrote a framework that people can utilize, because we believe that the only way that we can end HIV is by utilizing an HIV racial justice framework. And so MIPA and GIPA and the Denver principles will be more complete if we also add a layer of an analysis by doing a racial justice analysis. Those are very important pieces of information that people can actually utilize as the ingredients when they put together their groups. I think that COVID-19 advocacy has been slow because of the overwhelmness of stupidity around how this pandemic is being managed. A lot of the things that we're talking in this conversation only happen in the U.S. The rest of the world are trying to do something more homogeneous, but here we're like a sore. How do you say una espina?
Oh, yes, we stick out like a sore thumb.
Yes, we do.
Yeah.
Eso sí, you know, and I'm sorry, Marcos, ¿acabaste?
Hmm.
I'm assuming yes.
Yes.
¿Acabaste?
Yes.
Okay. I just wanted to also add to it to like bring in the spirit of the Denver principles. Here is the opening statement for the Denver principles. We condemn attempts to label us as victims, a term which implies defeat, and we are only occasionally patients, a term which implies passivity, helplessness, and dependence upon the care of others. We are people with AIDS, and that right there speaks to, I think, the need of COVID-19 advocacy today. And right now, you heard it here, folks. We are envisioning imagining a Denver principles for COVID-19, folks.
Mhm.
And as I said, go ahead, Gary.
Next, also is a very important part about this, and we have this as part of HIV advocates. We have as part of HIV Equal. It is also about loving yourself. We've all been through terrible, terrible upbringings. You know, we've all been stigmatized growing up, especially part of the LGBT communities and everything. So we've all gone through that. But we also have to empower people to love themselves, to know they're not alone. Okay, to know that there's people around them that are going through the exact same thing, that you can share all this. And as I said earlier, we now have the power of social media to be able to use as a tool for that. I mean, tonight, let's start COVID advocates. I mean, there's no reason why it can't just start just like that.
Yeah.
We'll call it COVID
We can,
advocates, and we can sit down with all these organizations in the States. And I'm serious. I believe just like ACT UP and TAG went to Tony Fauci, we can get Tony Fauci to work with us on this. He will be there during the next administration with President Biden and Vice President Harris. And we can just take this and roll with this, because this is going to be around for a long time. We're not going to have a vaccine that's going to get to everybody for at least another year, if we have one that's proven effective at this point. So we certainly can create that whole thing right now. COVID advocates, okay? And we can come up with the top
so
5
people,
you need to know. And not number one being on the list is very simple. You know, wear your mask when you go out and when you're getting within 6 feet of people, okay? And social distancing. You know all the messages, but we need to get it out there, okay?
Thank you, Gary.
so people
Mark.
should contact. So Gary's. I'm calling you Gary, Dr. Blick. So people could contact us, and we can actually gather their names and information, so we can come up with a meeting soon and start organizing for the ground up. What we talk about the Denver principles, completely modify and transform how public health is actually now used, where now people, at least some of our public health officials, do care for what we think, the occasional patients, and and there is no difference with COVID-19. I think that the stigmatization of COVID-19, again, by the higher level of government and the politicization of COVID-19,
Yes.
is stigma is the culprit of some suffering, and people should like Gary said, should feel empowered to actually ask for help, to give themselves a chance to take a break. You know, people, if they are telling you to work in that meat factory, and you know that you're at danger, just leave. Don't you? Nobody controls you. Nobody is going to. You need to take care of yourself. And the times that we're living right now are extraordinary. And I think that anything, the work that I do with the CACOS and HIV Racial Justice Now, we actually are doing strategic planning because we want to address the existence of COVID-19. Because from now on everything that I think of around social issues, I have to include COVID-19 into the mix. And COVID-19 happens to be a big modifier of how we live our lives. And if you think about it, it makes sense that we need to change things completely. It makes sense that we also need to look at the root causes of all of the injustices that we're seeing, and we cannot mm, just not address the fact that this country has been a racist country since the very beginning, and for people, especially white folks, to actually acknowledge their privilege and just engage with people that are different than you, because at the very end you're going to realize that they are just like you, and that at the end we're all the same. um, and these ideas that people have of owning the land because their ancestors, like here in Reno, I have heard people that they ask me to go back to where I'm from, and I'm like, I don't engage in those situations, but I think about it, and I think, who gave these people this idea that they own this piece of land which it wasn't really even them to begin with. So there is a lot of lack of acknowledgement of privilege around our society.
Mm.
And acknowledging your privilege, that doesn't mean that you are less than anybody. It means that actually you have empathy. In the world, we have seen in the past 4 years a diminishing on empathy around the world. People are very easy to just go into a negative um, part of you than to think positively. I decided to stop being critical of my colleagues since the very beginning of this administration, and in a way, I decided that I am not going to criticize people. I am not going to put them on the spot. I am going to I'm going to support them, um, and that only thing that I've done with my life in the past 4 years has changed completely. Also, how I see the world.
Mhm.
People should do those kinds of changes right now. This is the
Marcus,
time to do them.
that's a great point, Marco. I want to make it really, real quick on that. Is
Yeah.
listen, we're not going to change everybody, okay? There is racism in this country, okay? And Marco, like you said, when somebody tells you go back to where you came from, look at them and say, listen, I love you. You know, you have your right to your opinion. I have my right to my opinion. You have your right to your space. I have a right to my space. I love you, and you're entitled to that. And instead of like getting down on them and confronting them and trying to change them, no, I don't think that really works. We can't change everybody, but the other 2/3 of the country, they can be empowered. They can protect themselves. If you worked in that meatpacking plant, Marco, maybe you can't leave because you really need that job and you need that money, but you can know that you can bring your mask to work and you can try to keep your distance from your fellow employee. I know how difficult that is in a meatpacking plant, but you can take measures to even go up to your owners and your managers and try to empower them to say that you're at risk and all that bit. So there are basic things that can be done. We're not going to change everybody, but you can love that person who really doesn't love you, who is really, talking about you as, with racism and with contempt and everything like that. We're not going to change everybody, but we can work with the other 2/3 of this nation that don't feel like that and can be empowered with the proper information and the proper facts about that. Listen, empathy is a really, really important thing, Marco. Empathy comes from within inside. We don't have it at the top right now. We don't see any kind of empathy from our leader right now at this point, but it can come from all the other people. Listen, I wonder we can start conversations now going on with the future President Biden and Vice President Harris and get these words out and get this coalition going just from talking about it like we are tonight.
You know,
We actually met with the with the Biden campaign just on Monday. A number of us from the HIV field, we requested a meeting, and you'll learn more because there's going to be something in the news, I guess. But um, we have met with them, and we haven't talked about all of the issues that we're talking about here. Um, and I think that every single community that is dealing with anything that you think that the future government hopefully need to know, just contact the campaign and ask them for a meeting with the candidates so they can actually
interesting.
hear from you what is it that you need in the community, because again, you are the expert of your community, nobody else.
Thank you so much, Marcos. So I don't like both of you right now because every answer you gave me has caused me to write all these notes and I can't get to them because we've already reached the end. I was actually kind of shocked when I was given the 15-minute mark. I did want to add and say that there were, if a COVID-19 advocates or something like that were to happen, I wanted I reached out to folks who are openly COVID-19 recuperating to be part of this panel and also happen to know about healthcare, the field, public healthcare, and how it works. And I could not find one.
Really?
And so I think that thinking about creating something like that will need to include obviously you need to really ask those folks to be part of that space and also be given them an avenue to reach out. So I'm going to be putting my email out there, Latinx at New Haven Pride Center. I'm sure that Dr. Gary Blick would not mind being reached out to also. by folks who would like to create something like this, because I'm telling you, I feel like this would be really needed right now. And those of us who are HIV positive have a special duty to look out for our, for our brethren. We have a sense of solidarity, is what I mentioned earlier. And so, in closing, I just want to thank you both so much for being part of this. This is obviously something very needed. We were talking over each other. This is a space that is very much, I think, part of the future of what we're talking about in terms of not just HIV/AIDS advocacy, but really COVID-19 advocacy and public health advocacy as a whole. And so I want to close with a quote from the late Larry Kramer and add a bit of an addendum. Larry Kramer said, "The proudest achievement of the queer community, of the gay community that the world could ever claim is saving HIV/AIDS lives. That is 6 million total saved thanks to protease inhibitors. That is something that we have done before, and I know that is something that we can do again." I want to thank you so much, Marcos, for being with us today. I want to thank you so much, Dr. Gary Blick. This has got to be a conversation that will continue. The amount of energy that we lifted here is just lifting my heart, and I thank you, appreciate you so much for being part of this.
People want to just go onto our HIV Advocates Facebook page and start talking about what we talked about tonight. We start the conversation tonight.
Beautiful.
And I wanted to very quickly thank our interpreters who stayed with us, and thank you so much to both of you.
Thank you, Max, and thank you, Mark. Appreciate it. Thank you.
And of course, the wonderful magic in the back is Patrick Dunn and really the whole staff. This is my first Pride here in New Haven, and I got to say, it's going to be a memorable one for the rest of my life. So I want to thank
our fearless leader, Patrick Dunn.
Patrick Dunn. Heavy at work. So thank you, everyone, so much for joining us. Muchas gracias. # Black Lives Matter. And of course, happy Pride, everybody.